I don't really recall ever hearing or learning about nurse anesthesia as a Canadian student. A lot of the focus was on nurse practitioners. So once I graduated from the University of Windsor, my first job was in the Metro Detroit area, where I had my first exposure to the nurse anesthetist profession. When I transferred to the open heart unit, about 2 years later, I had my experiences and my exposures to nurse anesthetists kind of grew exponentially. So from there on, I was able to inquire about the profession, learn a lot more about it, and realize that it was pretty great, and it piqued my interest. Who was instrumental in earning my master's in anesthesia? Definitely, first and foremost, my husband. He was my biggest supporter, my biggest fan the whole time. He helped me move, he supported me financially, he did it all for me, and I couldn't be more thankful to him for that. Being a CRNA and having one patient, one time, I can put all my focus on them and just it's just me and them, and I can just pay the best attention and just give them the best care possible, because it's just one-on-one. It's just that gives me a lot of pleasure, a lot of joy in that for me. Working in Toledo has been very rewarding. I went there because I did my clinicals as far as what an actual work day looks like. You get a patient assignment, you go in, you set your stuff up in the morning, and you just kind of go with the flow. Some things change, some things, your day's kind of set in stone. Sometimes you're all over the place, and that's kind of an exciting part of it. There's never a boring moments. You get to see all kinds of interesting things, and the variety of things that you do is great. So it's definitely not you never get tired, you never get bored. It's fantastic. It's the greatest job ever.